What's up, my country people? Welcome back to my channel, and we're continuing with our series of pregnancy. If you're new here, hi, welcome. My name is Dr. Linda Opanga. I'm a pharmacist, and in this channel we just talk about health, your fitness and nutrition. So I'm glad you're here with me, and please consider subscribing. Hit the subscribe button so that you can join this family. Today we are going to talk about danger signs in pregnancy, and these are just the warning signs that a pregnant woman is supposed to look out for so that they can be able to be attended to by a doctor in case the signs come. Let us dive into it. The first sign is severe nausea and vomiting. Most women usually suffer from morning sickness, and this is normal, but when it reaches a certain limit whereby you're vomiting very many times in a day, and a condition called hyperemesis gravidarum, I did a full video on that. I'll link it up here so that you can go and see. So that is number one warning sign. If you have very severe nausea and vomiting, please rush to your doctor. Number two, we have vaginal bleeding. So vaginal bleeding is when you're pregnant. It could be a sign of various things. So in the first trimester, especially the first few weeks, it could be spotting. So when someone is pregnant, they can spot, and this is usually a very light period, not compared to your normal period. And then it's usually for very few hours or very few days. Someone bleeds and then it stops. So number one could be spotting. Number two, bleeding in pregnancy could be a sign of an ectopic pregnancy. So make sure when you actually notice vaginal bleeding, go to your doctor so that they can be able to check you. In the third trimester or the second trimester, it could be a problem with your placenta. So placenta abruption, and it could be placenta previa. It's an issue with the placenta. So if you notice that you're bleeding in your third trimester, please go and see your doctor. It could be an issue with your placenta. Also, bleeding could be a sign of a miscarriage. So whenever, especially in the second or first trimester, if you're really bleeding and you're pregnant, please go get checked. It could be a sign of a miscarriage. The other sign and symptom that you should actually look out for is the presence of convulsions or fits. If you are pregnant and you start convulsing all of a sudden, please rush to your doctor, because this could be a sign of eclampsia or pre-eclampsia. I did a whole video on that, and I'll link it up so that you can also go and check it out. Another warning sign that you should look out for is reduced fetal movement. So towards the end of the second trimester, if I'm not wrong, you are usually able to feel the baby kicking, you're able to feel your fetus moving and all those fetal movements. So if you realize that the movements have actually reduced, you can call your doctor, or I actually read somewhere that you can actually drink something cold or something warm so that you can actually feel whether the fetus will be able to wake up or not. So if the fetal movements are reduced, please be able to call your doctor and ask for guidance. Another warning sign is severe headaches with dizziness. So if you feel that you have very, very severe and bad headache, and you feel like dizzy, you feel like falling down, please make sure you see your doctor, because that could be a sign of preeclampsia or eclampsia. A warning sign is severe abdominal or pelvic pain. This could be a sign of an ectopic pregnancy, and if you experience this, like you have frequent abdominal pain or pain in the pelvis area and you're pregnant, please make sure you call your doctor so that they can be able to advise you, because it could be an ectopic pregnancy. Another warning sign is swelling of the hands, legs and feet. So if you realize that your hands and feet are swelling, and this happens especially in the third trimester, or if it happens before the third trimester, you could go and see a doctor, because that could be a sign of preeclampsia or eclampsia, high blood pressure in pregnancy. So do not ignore when you see this sign. Just call your doctor and ask them, like, hey doc, I'm having my feet are swelling, I'm experiencing edema, please, what can I do? And they'll be able to advise you accordingly. So the other warning sign is early contractions, especially before the 37th week of pregnancy. So there's usually something called false labor. I'll talk about it in another video. And this could be a sign of early contractions before the 37th week of pregnancy, could be a sign of preterm labor. So when you start experiencing frequent contractions in pregnancy. I don't know what labor feels like, but if you feel the contractions are coming and they're increasing with the intensity, please let your doctor know, because you could be going into a preterm labor. So I hope you've learned something about this, and that if you're pregnant out there, you're going to look out for these signs and symptoms, and you're going to please call your doctor. And another thing is, please make sure you attend your prenatal visits, because during the prenatal visits they'll be able to tell you more about now these signs. They expound on them, so that if you have any of them, you can be able to tell your gynecologist. I hope you learned something in this video, and I hope this video will be able to teach you a lot if you're pregnant or not. If you're planning to be pregnant, this could be a good source of information to you. And yeah, thank you so much for being my audience. And in case of any questions, please let me know in the comment section, and I'll see you in my next video. Bye.